Hi, this is Ryan Holleen. In today's video, we're just going to discuss a hip hinge. If you're having low back pain, a good clinician on their initial assessment will usually do some movement screens, and what they're looking for is whether you are employing a hip hinge pattern with certain activities. If you do not pass this test, most therapists will start with a dowel. This is just a nice way to get people used to the hip hinge movement pattern who are unfamiliar with it or it doesn't feel natural to them. So you're going to line it up along the spine. 3 points of contact, back of the head, mid-back, and butt or your sacrum. And from here, the therapist is going to ask you to bend forward at the waist without losing those 3 points of contact. And the emphasis is on a neutral spine and flexion and extension at the hip. So as you can see, if I were to lose my neutral spine position by flexing my lumbar spine or rounding my low back, I lose the points of contact, and that's not what we want here. So 3 points of contact, neutral spine, using a hip hinge, flexing and extending at the hips like that. So that'll definitely help you become more familiar and have that hip hinge pattern feel more natural. But what we're gonna do today, in today's video, is we're gonna give you a highly functional variation of a hip hinge called the shortstop squat. This is especially helpful for picking heavy objects up off the floor. We're gonna demo this first using this bucket. We're gonna pretend this for 50, 60 pounds. And we'll just show it to you from a couple angles. So if you have the opportunity, the object isn't too awkward and you can get it between your legs, it's a good idea to keep the heavy object close to your body. Get into this shortstop squat position, grab the heavy object, and then pull your hips through like this. And then to put it back down, you just do the reverse. So again, into your shortstop squat position, grab the heavy object, and then extending the hips, pulling the hips through to get back to get to upright. Let's break down that shortstop squat position a little bit further here. So we'll start here. What you're gonna do, actually we'll start with the hands. Hands like this, and you're gonna take them and slide them down your thighs until you get to right above the kneecaps, and you're gonna hook your hands around your kneecaps like this. You're gonna kind of lock out your elbows and extend your arms. You're gonna kind of carry the weight of your upper body in your arms like this. And I'm gonna want you to do the opposite of a shrug. So this is a shrug here. I'm gonna want you to anti-shrug. So depress your shoulder girdle, kind of activate your lats, and again, carrying the weight down of your upper body down through your arms. At this point, nice check. Knees should be over the balls of the feet, and your weight should be at about, your body weight should be at about the mid-foot. So you can lean forward onto your toes from here, and then lean back onto your heels. And ideally, you're gonna want your body weight somewhere between those 2 points, so about the mid-foot region. And next, if you're unsure if this doesn't feel so comfortable for your lumbar spine, when you have your weight of your upper body carried through your arms like this, you can kind of mess with the angle of your lumbar spine, do a little flexion and a little extension, and try to find that sweet spot that feels comfortable for you. So right about here feels comfortable for me. And last thing we're going to talk about is just one of the most common mistakes is once you get into the shortstop squat position and you grab a heavy object, instead of, a lot of people are thinking about picking the object up, and they start to lift with their back, and the motion, the start of the motion occurs at the lumbar spine instead of at the hip. So you don't even want to think about lifting it up. You just want to think about leaving it there, and from here, so maintaining your anti-shrug position, leaving the heavy object there, and simply just extending your hips. So like this, pulling your hips through. Again, so it's, the pattern is more of this than it is this. So I'm not sure if you can see the difference. The second one, kind of extend, you getting the motion out of the low back, and then the hips kind of follow. But ideally, you want that motion to start at the hips, just like this.